Larry Anderson, Life and Reason, Depression. I discussed the setup of the chart, that the vertical is functionality and happiness, the vertical line. The dotted line represents a normal life. The horizontal line is a representation of time. And we got to the point of, we talked about the tipping point, and now I want to talk about the trigger points. The trigger points, I've discussed when suicidal, I call it the snake, when the snake is, it's time to be especially aware of the possibility of suicide. You will, it's a little bit easier going down in the depression to recognize the danger points of suicide than it is coming up. Is that true? Yeah, it's been sort of true for me and sort of not. I think I've had it be dangerous on both sides in my life. Oh no, it's easier to spot on the way down because you know that you're sinking. You'll still, your functionality becomes less and less. You start to vegetate out. You climb back into bed rather than standing up like a man because it hurts too much, and those sorts of things. And so there are signs. I mean, that's the idea. I'm supposed to share with you how to recognize the signs. It's easy to recognize the signs on the way down because you'll see functionality get worse and less functional. Happiness just is farther and farther away. People are farther and farther away. So, you know, there's the warning. If you start to have ideas of killing yourself, you're at a trigger point. That is a trigger point. That's when you got to get the guns out of the room so you don't pull the trigger. That sort of thing, right? Okay, that's what the trigger point is. Notice that usually on both of these it's associated with some sort of peak or valley, something especially steep or especially sharp. So that on the one down you should be able to recognize. For the loved ones, how do you do it? For people outside of the depressed person, there are two things to look for. No, there's one thing to look for. There are two circumstances. One of them is very hard because the person is disguising his suicidal ideation. And in the other one, the person is not disguising it. So, if the person is, suicide ideation starts to happen and the person is recognizing and he's self-aware enough to know that he needs help, then he may manifest some sort of you know, where to keep the handguns, or you know, he might ask for something that's very strange, or be talking about not blatantly perhaps talking about ways to kill himself, but discussing poisons or something like that, and sort of a cry for help. It could be subtle, and it could be you know, it could be not so subtle. Sometimes, you know, there are people. I don't want. I'll just say this once. There are some people that aren't really that depressed, that just want attention, and you know, will cry out. But who cares if someone is crying out and they think and it looks like they're going to hurt themselves? Well, do something. You know, even if they're just a spoiled brat or something. You know, make sure that you don't make a mistake there, because if it is sincere, boy, that would be tough to lose someone that asks for your help. Okay, but the other one is you can't. The loved one can't see it because they don't want to talk about it. They're actually having suicidal ideation, and they're planning it or thinking about it, and they don't want anyone intervening in the process. Okay, so I think that covers it for the going down, and of course that applies to going up. But the There's subtle differences between the two. Going up. Going up, as you'll notice, your functionality will, the depressed person's functionality, your functionality will start to increase, and so will a kind of eagerness for a normal life, because as your functionality returns, you're going to want to do something. You're going to live again, because all of a sudden life becomes a possibility. It's not remote. It's, somewhere out there on the horizon, however distant it is.